Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Happy day and welcome back to the Healthy Living edition of KUAM News Extra. The gallbladder is a small pear-shaped muscular sac that acts as a storage tank for bile. Bile is made in the liver and is sent through tiny ducts to the gallbladder, and it helps break down the fat in the meals you eat so that your body can utilize them. Bile is also a very powerful antioxidant that helps to remove toxins from the liver. Here to tell us everything we ever needed to know about the gallbladder is Express Care's Dr. Jitka Lom. Thanks, Doc, for coming in. So why should everyone be concerned about having a healthy gallbladder?
Well, actually, most of us don't ever think about it. It's one of those very humble, silent little organs that does its job all day long, every day, without any help from our thoughts at all. And, you know, our gallbladder really is not noticed by us until there's trouble, and that's usually when there are some stones in it. So then people notice because they're experiencing pain, they're experiencing burping, indigestion, unpleasant digestive symptoms.
What causes gallstones?
Okay, well, as you mentioned in your introduction, the liver makes bile, and it makes it continuously. But then you need some extra bile when you are digesting fat especially. So if you eat a fatty meal, at that point your gallbladder kicks in, starts squeezing bile into your digestive tract. And at that point, the bile helps the fat get absorbed and so on. So if the gallbladder is not squeezing properly, there's some dysfunction there, then there'll be sludge. Those bile salts will be sitting around, turning into just basically like a gravelly material, and then even accumulating into larger stones. And the stones can be very huge. They can be, you know, basically the size of a golf ball sitting in there. And then, of course, when your gallbladder tries to squeeze out a golf ball through a tiny little duct, it's not going to work, and then people experience a lot of pain. It's usually in their right upper quadrant here, in the right side under their rib cage.
Okay.
Yeah.
Now, are gallstones also tied into gallbladder disease, or are those two separate things?
Well, that's the main gallbladder disease. There are some other diseases you can get of the gallbladder, polyps, certain cancers even of the gallbladder, but the one that's the most common are gallstones.
And how can people avoid getting them? I've heard they're very painful.
They are very painful. Some of them are hereditary factors, so you can't completely avoid it, but eating a very unhealthy, fatty diet tends to aggravate things. So I would just recommend that people stay away from the greasy fried foods. Well, that's a general good advice anyway.
Okay, now do you need surgery to remove how do you get rid of them?
Yeah, well, it depends if they're causing trouble. Sometimes an ultrasound is done for some other reason and the gallstones are found. In that, if they're not bothering you for any reason, you just leave them alone. But if people are experiencing what's called biliary colic, where they eat a greasy meal, a hamburger, they get pain, they start vomiting, the pain is really intense. It travels from that side over into the back. They're having a lot of pain. They're having these attacks every time they eat a greasy meal. That's not livable, so they're going to need to have surgery. And the surgery is done through a laparoscope, which is like keyhole surgery, tiny little holes in your abdomen, and they can pull out the gallbladder through your belly button, basically.
Oh, wow.
Yeah, but there's no other way to really break up stones in the gallbladder. Like, for example, kidney stones can be shattered and urinated out. You can't really do that with the gallbladder, so the only really effective treatment is to have surgery for them.
Okay, so there's no kind of medicine. So once you have them,
once you have them, you usually have them. If they're teeny weeny, maybe they can pass. But once they're larger than about 2 or 3 millimeters, they're going to be in there.
So prevention is definitely key.
Yeah.
All right. Now, how can you tell if you're having trouble digesting fat?
Well, yeah, many people do actually have trouble with their fat digestion. They will have burping, bloating, very foul stools, very, very, and the stools actually float. I mean, that's really kind of gross, but it's the way it is. And they're very stinky. And they may have malabsorption, where there's certain vitamins that you cannot absorb if you don't have proper fat metabolism, fat digestion. And this is vitamin A for your vision, vitamin E for your skin, A is also for your skin, K for your clotting, and vitamin D for your bones. So if you don't have good fat metabolism, it can affect your overall health.
Okay, anything else that you want people to know about the gallbladder before we head to a break?
Well, lots of times people think they have an ulcer because they'll experience pain in the center part of their abdomen, and it's related to their food, and they're not sure, and they think they probably have an ulcer, and they take a lot of Zantac or Tums. So if you're doing that kind of thing, go get checked up, because it's possible that you have a gallbladder problem, especially if you're a woman over the age of 40. If you're a little overweight, that's a common problem.
So it might not just be acid indigestion or anything like that. All right, Doc, thanks so much. We will get to our viewer questions after the break. Stay with us. Healthy Living returns right after this.